Our next herpes virus is varicella zoster virus, more commonly called chickenpox. The thing with varicella zoster is that it will cause a recurrent infection. So the first infection is varicella or chickenpox. The recurrent infection is herpes zoster or shingles. This is closely related to the herpes simplex viruses. So the herpes simplex viruses are human herpes viruses 1 and 2. Varicella zoster is human herpes virus 3. So they're really closely related. However, unlike the herpes simplex viruses, which are transmitted by generally close contact, chickenpox is transmitted through respiratory spread. And infection will generally begin in the tonsils and respiratory mucosa. So you'll have infection of the upper respiratory tract. You can get viral replication in regional lymph nodes, and then primary viremia, where the virus is being transmitted through the body, viral replication in liver, spleen, and other organs. And then you get a secondary viremia, and this is when you get infection in the skin. During infection in the skin, you get the formation of a rash, you have fever, and during this secondary viremia is when the patient is contagious. So there's actually a lot that happens between exposure and development of symptoms that are noticeable. So you have droplets spread into the respiratory tract, lymphatic system, so you can follow the virus here, and you have what we commonly see as chickenpox, right? Those blisters on the skin. And of course, just like the other 2 herpes viruses we've discussed, latency in the neurons. Shingles, so that herpes zoster, that recurrent manifestation of the virus, will damage the neurons. It can be very painful. The latent virus will be activated with a depressed cell-mediated immunity. So we tend to see shingles in patients who are older, in patients who are immune compromised, in patients who have other sort of complications. The youngest person I've ever seen shingles in was a student of mine when I was teaching at a community college, and she was 29 and had recurrent shingles outbreaks because she had lupus. So it's not common to see in patients who aren't significantly older. I'm talking like 60s and older, but it can happen. Antibody is important in limiting the spread of the virus, because remember we saw there's two times that it goes viremic. So having antibody can be really important to help limit the spread, which is why if a patient has been exposed to chickenpox or shingles and hasn't ever been vaccinated or hasn't had the infection before, a passive immunization after that exposure can protect. And you do see that delay, like up to 10 to 15 days from exposure to developing symptoms. So treating a patient with preformed antibodies can help. It is highly communicable. It's estimated that up to 90% of adults have antibodies against varicella zoster virus. If you're talking about people my age, it's because we all had chickenpox when we were kids. If you're talking about people born, the vaccine was introduced in like 1995. So if you're talking about people born 1993 and later, many of them have antibodies because they've been vaccinated. So unfortunately, for those of us who actually had chickenpox as children or even young adults, we are at risk for developing shingles because the virus can reside in the neurons. Shingles, not a guarantee, but it can develop in 10 to 20% of patients who've had chickenpox. And 30% of patients will develop something called post-herpetic neuralgia, basically significant nerve pain that doesn't go away. The shingles lesions do contain infectious virions and can infect susceptible individuals. So if I'm not mistaken, and I don't have the chart right in front of me, I believe that children get their first chickenpox vaccine at the age of 2. It might be 1, but I think it's 2. So if grandma has shingles and baby hasn't been vaccinated and grandma has an active infection of shingles, or grandpa or whomever, it is totally possible that that patient can give the child chickenpox. So chickenpox is a common disease of childhood, was a common disease of childhood. People even used to do things like chickenpox parties. Thank goodness my parents were not like that. If yours were, I'm sorry. Where, oh, well, might as well get it over with. And, one of the kids in the neighborhood has chickenpox, so everybody will come over and we all get chickenpox because everybody was going to get it anyway. You might as well control when you're going to get it. What happens with chickenpox is that small vesicles will appear after about a 14-day incubation period, and they'll recur for 3 to 5 days. This is kind of what they look like. They can appear on all surfaces of the body, including the scalp, inside the mouth, the conjunctiva, and the vagina. So, very unpleasant. The primary infection is actually most severe in adults. And so I want you to think about this. This is a virus, just like herpes simplex 1 and 2, where a lot of the symptoms we see, like the blisters and the rash and the fever, are caused by the immune response. Sure, the viral infection does things too, but the immune response can also do things. So that's why adults actually might have a more severe primary infection, because they have such a strong or robust immune system when compared to very young children. Now, that is not to say that very young children don't get severe disease, but it is part of the reason that people wanted their children to get chickenpox rather than their teenagers or young adults. So the other thing to think about is that, chickenpox, you can't predict how it's going to affect an individual. So vaccines are much better because then you don't have any sort of risk of the child getting the disease. So I remember when I got chickenpox, it was actually my brother, my little brother, who brought it home from daycare, and he was like 4 or 5. And I mean, the kid was miserable. I mean, he had blisters all over his body. The blisters are so itchy. I mean, he was constantly wanting to scratch, and he was crying because he couldn't scratch, and he itched, and he was in so much pain. He was so miserable. And then I saw him and I'm like, oh, this is wonderful, because I knew I was going to get it next. And I did. And I had like so few lesions. Like I could literally count them. I had so few, and I barely itched. I hardly had any problem at all. And I think he was 4 and I was 9. He might have been 5, but I remember I was 9. So I was older. I should have had a better immune system than him, more robust, perhaps more symptoms, but for whatever reason, he had it far more severe than I did. So you never know. And then what you see here is this is a shingles outbreak along a nerve in the chest. Typically, we see shingles on a single nerve. It won't be a full body infection. I know patients who have had shingles, like my mom can get them every once in a while because of a medication she takes that kind of suppresses her immune system a little bit. And, she'll go to the doctor. She says it's quite painful. And one time the doctor told her, well, I actually have a patient who gets his shingles outbreak on his optic nerve. And my mom was like, cool, I'll stop complaining then, because, on my leg is a lot less painful than on my eyeball. So it can be on any random nerve. I think my mom's is on her sciatic. That guy was on his optic. This one clearly on the chest. So it really depends on which neuron it's found in. The cytopathic effects are going to be similar to herpes simplex infections. You're going to see cell lysis. You'll see syncytia formation. You can diagnose chickenpox from antigen or genome detection. Generally, if a child has chickenpox, varicella, you don't treat them. If a patient is immune compromised or if a patient has shingles, you can prescribe nucleoside analogs. There is a vaccine available for children over the age of 2. There we go, over the age of 2. And there is a stronger version of the vaccine for patients who are over 60 to help prevent the onset of zoster or shingles. Again, this doesn't help patients who are younger, like my previous student who was in her late 20s and developing shingles because of lupus. My mom's medication, she was getting her first shingles outbreaks in her early 50s. Again, she couldn't get a vaccine. Actually, now she's been able to get the vaccine. She hasn't had a shingles incident since then. So the vaccine really works well, highly recommended, but unfortunately over the age of 60. So this is one of those that, yeah, sure, most kids survive chickenpox, but you're preventing the onset of later disease as well.